Good day to all of our viewers speaking English in Curaçao. It's been some time, but I'm back again to give you an update. You might have heard that we've detected a new variant of SARS-CoV-2 on the island of Curaçao. What does that mean? And is that surprising? How did this happen? What's going on? And what does it mean for us? So let me start by saying this. Yes, we have new variants. We have different ones. We have the UK variant. We have the South Africa variant. There are the two Brazilian variants. And how does that happen? Viruses, they can multiply very quickly, much quicker than us humans. So during the course of one day, there are about 25 generations are being passed over. So you can imagine they mutate a lot quicker than humans do. And why do they do this? They look for better survival of their species. And how do they survive better? By increasing their rate of being able to go from one human to the other, because they need us to keep alive. So their best chances of keeping the species alive are by finding a more effective and efficient route of transmitting from one person to the other. So this is what they do. So they can spread quicker, they can go from one person to the other quicker and can spread quicker in your society. That's one problem with the new variant. And the other problem is we're not completely sure whether or not it gives you a bigger burden of disease, so if it makes you actually sicker. But even if it doesn't do so, if it affects more people in your society, it will also affect a bigger proportion of the vulnerable group that does get more severely sick. And there you have the problem, because if that becomes too big, then that is of course a big stress on your healthcare system as a whole. So that's why it's an issue to look at this new variant. So is it a surprise that it came to Curaçao? And the answer of course is no. As we said in the beginning of the epidemic to begin with, when we were talking about Curaçao, it's not a question whether it will come to Curaçao. The only question is when will it arrive? Because we are all interconnected. We live in this world and we're part of the world, and people move from one place to the other. So viruses spread with people, and that's why sooner or later the virus will show up, as it did in Curaçao. So how did it come in? The person that we detected it with lives and works in Curaçao, works with tourists. His immediate contacts up until now have all turned out negative when we tested them. They're in quarantine, so they should be tested again today. But there's a co-worker that did test positive, and especially one tourist that came from the Netherlands who also tested positive, who in the meantime is already out of isolation, is not infectious anymore, and already went back to the Netherlands. And we think that was most probably the route. How do we prove this? Like we proved the first one, we send random samples of positively tested persons. We send them to the virological lab of the public health, the Royal Institute of Public Health and the Environment in the Netherlands to do the sequencing. That means looking at the genetic material to see whether it is a new mutant and a new variant of the virus itself. We sent samples that were going back to about 4 months. And the newest samples were from in the period between the 17th of January and the 26th of January. 17 samples were in that period, and one of those tested positive, and that's the person I just talked about. So we are going to send the samples of the co-worker that also tested positive, as well as a sample of the Dutch person that came to visit. We will send that as well. Not sure if that's going to yield anything, because we got the tourist's sample probably at the end of the infection. So the amount of virus in his body wasn't all that great. And that means that your chance of actually getting a good sequencing done is a little bit less. So let's see where it goes, but we are pretty sure that that must have been the route of transmission why we have it here in this island. So what does that do for us? And why is it important then to keep, because this is exactly the reason why the measures that are in place were not really relaxed more recently, why we kept them the way they are, because it's very important to keep your situation under control. Because if it isn't, if we're in a situation where there's an epidemic again, where there's a lot of cases, And in between those, the new variant comes in and gets a chance to spread, and you're not able to detect that in time, then it will very quickly get out of hand and you'll be in big trouble. Let me try to explain how that works. Because, so if you don't keep the situation under control, remember that all we see is only people that we actually detect. But there are more people who are either asymptomatic or pre-symptomatic, or they have very little symptoms, and they don't even know it themselves, but they are positive and they can spread the disease as well. So what we actually detect is actually only a part of what is really infected. So behind me, this is a graph. This is the graph that shows the R number. What is the R number? That's your replication number. That means that if the R is 2, it means that every one person that's infected can infect 2 others, and each one of those can again infect 2 others on their term, and that's how the virus keeps on spreading. So what you ideally want is the R under 1. This is 1, this line. So what you see here, this is the period in November where it started going up, where we had to take measures to get that R back down again under 1, which is what happened. And then you see a little spike here. What is this spike? Because we kept the measures, after we relaxed a little bit, we kept the measures at a certain level. And we kept them throughout the holidays, throughout Christmas, New Year's, you remember. But although the measures were still in place, you and I both know that, of course, during the holidays, people come together, little parties at home, Christmas dinners, etc., New Year's Eve. And so you see the reaction 2 weeks later, and you see a small increase again. You see that over here. And afterwards, we went down, and then this happened. What happened there? This is where we further relaxed the measures. Remember, curfew was relaxed. The prohibition of alcohol was relaxed. Restaurants could open longer. Trukipan stayed longer open. People had a sense of getting into party mode again. And then we saw this. And of course, that stayed there. And now we maintained a pretty good level and we're doing all right. But this shows you, as soon as you relax measures, your amounts go up. And if in between the new variant comes and shows up, and there are more people that get infected, because that's what this new virus does, then it will very quickly get out of hand and surpass 1, 1.4, 1.6. And when that happens, we'll be in very big trouble. So at all costs, we have to try to remain level low, so that if it does appear, we can do our best to try to keep it down and as low as possible. I hope this was clear. The things that we have to do now, same things as we said in the beginning. Maintain your distance. If you see lots of agglomerations of big groups of people getting together, stay away, turn away, go back home. You don't need to be there. It's not a good situation for you or for anybody else. And remember, keep your vulnerables safe. Keep your elderly safe. Keep the people that have chronic disease safe. Do your part and we'll be okay. Thank you very much.